Do you think TRT is safe for all men over 50, even if they have heart disease in their family? At MikeOHearn. So yes, testosterone replacement or hormone replacement therapy can be safe for an individual that has heart disease in their family. It's actually been shown that testosterone is not negative for the heart, but actually positive for cardiovascular system. So at that point, like, you're actually going to benefit from taking testosterone with your heart. Now, obviously, listen, if you have like open heart surgery or you have something like that, and a physician says that this is probably not be the best bet for you, then we're going to follow that. But if you have heart disease in your family, which I do too as well, you know, at that point, and that person's on testosterone, been on testosterone for at least 13 years. And at that point, cardiovascular, as far as me, is pretty good too as well. Echocardiogram and such. I've done a couple other testings just to make sure, but there's other studies out there. It's not just from me studying, right? Like, there's major studies out there for cardiovascular health and debunking the negative cardio effects that could happen. Now, I will say, if testosterone is abused like anything else, yeah, it could have some harmful effects and have some negative side effects for people. And at that point, if it's monitored correctly, it's done correctly, and if you're on the proper program, then you're going to get all the benefits with no negative side effects.
I got a question for you, Johnny, just so I fully understand this. A person over 50 on TRT is getting their blood work, or they're getting their testosterone back to a good dose of what their natural testosterone may have been when they were in the 20s and 30s.
Yep.
For somebody outside of this asking about heart disease, wouldn't this just make the person healthier all the way around because his testosterone is still in that active phase of a normal range?
Absolutely. As we age, we decline, and these hormones and other things start happening there, right? It's like dominoes falling. So at that point, you know, all we're going to do is we're not going to jack you up. We're not here to give you like extreme numbers of testosterone, right? Like just pump you up. We're here to get you to an optimal level of natural, if that makes any sense. So higher up the reference range from, right? Like 264 to 916. We want to get you close to the 916 as possible. And all we're doing is we're taking back the clock internally. So when you were 18 to 21, your levels are probably the highest they were. Now, they probably were higher than 916, to be honest with you, at your natural level at your age. So, you know, if anything, we're taking you back to those eras, and that's what we want to get out of it too. We want to get that energy kicked back up. We want to get you feeling good. We want the body to start responding like it should respond. And that's going to happen with testosterone being in place and being optimal, and all the other functions start lighting up.